So in terms of intervention, so someone finds out from their GP that they have osteoarthritis around the knee or the hip, what happens then? Like, what would the steps be or the options be for it?
Okay, so osteoarthritis, super common. Add a candle to your birthday cake, add a bit of osteoarthritis somewhere in the body. And we know with osteoarthritis it's a gradually progressive disease, so that over time it is potentially going to become worse or aggravate you. And there's really two main treatment arms for osteoarthritis. There's the surgical side of things, where ultimately you end up with a knee replacement, and then there's the conservative side of things, which is what we deal with. And that's just a stepwise process that we take someone through, talk to them about the best options and where they come to us. So they may have already started some of that process before they come to us. But simple things like pain relief and analgesia to start with, and that is just your simple Panadol Osteo, good safe drug, and or an anti-inflammatory if appropriate for that patient. We have to take into account any cardiac or gut issues there. People will talk about various supplements around osteoarthritis. There's very mixed evidence around. There's a huge list that people may have heard of. Best spoken to in person with your sports physician about that. Braces, orthotics or supports, again, slightly mixed evidence around that side of things. The braces, for example, go from the cheapy ones that you can buy over the counter at the pharmacy that's just a simple pull-on, to the ones that are $1,000 odd that definitely do have their benefit for certain patients. Again, best spoken to with your sports physician. The two main ones that really there's so much evidence around and are so crucial is weight. So good evidence, losing even just 5 kilos can reduce your pain or increase your well-being significantly, up to 80%, and also exercise. So that's kind of where you guys as exercise physiologists come in around looking at how people move. Simple things like how do you get up off a chair, how do you take stairs, how do you get out of bed in the morning? Is that how you're moving? Is that affecting that load that goes through that knee or hip? And therefore contributing to pain or symptoms. And those are the two things in conjunction with just managing simple pain that really can make a difference if done well. After that, it's if we're still not winning with those basic measures, the other options that you can consider are your injection options, which we can offer. There's a few available with various amounts of evidence, but the three main ones that we offer at North Sydney Sports Med are your cortisone, hyaluronic acid or visco supplementation, or PRP, which stands for platelet-rich plasma.
Yeah, right. And so with those three options, when would you typically apply cortisone versus?
Yeah, so again, it's really patient specific or patient dependent, and it's about speaking to the patient, learning about them and what they want their knee, hip, shoulder, whatever it is, to do. Your cortisone's basically a big dose of an anti-inflammatory and therefore pain relief to a joint. It's commonly done, it's been around forever and a day, and relatively safe. But it is more of a short-term pain reliever. So if someone comes and has a super sore knee and is due to go on holiday, not that we can at the moment, but if they're due to go away or they have an event, someone's wedding coming up and they just want to be able to have a dance or something that they know they want their knee to be good for a short period of time, then the cortisone is a good option for that. So, and the amount of relief that you get varies with individuals as well. It can be 3 weeks, it can be 3, 6, 9 months from a simple cortisone. The other options are your hyaluronic acid or visco supplementation. There's lots of them on the market, and again, there's best spoken with your doctor. Personally, I have a preference of which one I use, but I would talk to the patient about that. That is a gel basically that goes into the joint and sits in there and changes that environment to more of an anti-inflammatory, pain-free environment. Again, they've been around for 20 plus years, they're safe, and that's a nice option. The idea is that it gives about 6 to 12-ish months worth of pain relief. Again, that varies with individuals, and it's just one injection. So you come in, you have your injection, there's no major downtime. It can take 6 to 8 weeks to really kick in, but a nice, safe safe enough option for someone for that, hopefully that more extended pain relief. And then there's the PRP, or platelet-rich plasma, which is a bit the new kid on the block, as it were. Now that is your own blood that we take. It gets spun down in the machine, and we take the platelets out of that blood and inject that back into knee. Those platelets, when they go back into your knee, release your own healing and growth factors, which basically changes that environment to more of that anti-inflammatory, pain-free environment. Super safe because it's your own blood. We're not adding anything more. It can be a bit sore afterwards, and the idea is that you need 3 injections done roughly about 4 weeks apart, and really helps. Nice evidence helps with reducing pain and therefore function, because it allows you to sort of do your rehab, get strong, and get moving again.
I mean, this from my this is anecdotal experience of patient feedback is probably that PRP is more hit and miss than the effects of cortisone, and then the hyaluronic acid supplements are probably in the middle somewhere.
Okay,
That's
interesting. So cortisone is often it's either going to work for you or it's not, and because it's that short term, it tends to be effective relatively quickly, and people are often pretty sore when they have it, so they get a good response, and therefore they have a positive experience with it and think, oh, cortisone's great. We are a bit limited. The rough guide is about 3 per joint per year, so you can't just keep coming and having them every month. That's not clinically appropriate. Interestingly, so the research actually, when they've looked at one hyaluronic acid or viscosupplementation versus the PRP, it says the PRP is more effective. And I would say clinically I do both, but patients do tend to get good results with the PRP. They definitely get good results with the hyaluronic acid as well, and it's just about talking to the patient, educating them around each of the injections, and then making the decision between the two of you, which is the better option.
I think when people the people that I've seen over the years that have the worst outcomes with things like cortisone tend to be people who are thinking of it as a fix.
Yeah, it's not.
So I try to, forever, whenever I'm suggesting someone maybe look into this as an option, that I explain it as a window, an opportunity maker. So if you can get it and it provides you some relief so that you can continue to challenge yourself a little bit more, because the pain is limiting your ability to do the things that are going to help you, then it can be really valuable.
So all that we do is purely just ultimately about pain management for the longer term. So we cannot change the status of the joint. There is nothing available that we can't undo any of the osteoarthritis. It's purely about managing your symptoms and your pain to allow you to do what you want to do as best you can, and being mindful that some of that stuff may change. Osteoarthritis is a progressive disease, and so and the progression is very individual as well, so we can't predict that necessarily, but it's just really about making you feel more comfortable, settling down any big swellings in the joint, and allowing you to go through a strengthening program or a rehabilitation program, just to allow you to go and walk your dog or play golf or ski once a year, whatever that looks like for you. We can't undo any of the other changes in the joint. That's what people need to understand as well. That's a huge part of it.
Yeah, 100%. They're definitely getting away from the feeling of what's going to fix it.
Yeah, there is. Yeah.
Yeah.